Hello, my name is Jesus Sapero. I am proud to be the Chief Nursing Officer here at Meritus Health System. It was my first Nurse Week here at Meritus, and it has been a fabulous week. We started the week with a proclamation from our county commissioners recognizing the 800 plus nurses here at Meritus for the care and excellence that they deliver to patients and families every day. We are making great strides in improving the quality of care, the satisfaction our employees have, and this was a great week to be able to recognize each and every nurse for the value they bring to our organization every day. As I said at the beginning, I am very, very proud of the nurses here at Meritus. I'm looking forward to many more nurse weeks and nurse opportunities to recognize our staff. They're doing an excellent job every day. Thank you, and we hope you enjoy this video.
One of the things is even before I was a nurse, I was a patient, and a nurse actually really inspired me, and the way that she treated me, and I think that personal connection with that nurse, and then I eventually came to work for her, it really inspired me as far as that goes.
Who was that? Do you mind mentioning who that
It's
is?
Jerry Bishop. Yeah, when I had my son, my oldest son is 23, and when I had him, I was very upset because he was actually shipped out of the nursery at that time and went down to Baltimore, and that was the time when you roomed in with another mother, and that mother that I roomed with actually had her baby and I didn't have mine in the room. So it was very hard for me, and I was young and I was upset, and she just kind of put her arm around my shoulders and said, you know, it's going to be okay, and you know, you have to look at things this way, and you want to do what you can do to get better so you can get out of here so you can go see him. And she just kind of made my whole focus being from angry and upset to more focused on him and trying to get better so I could get out of there for him.
I actually, when I got out of college, went into marketing, and I really was not a fit for me. I didn't like being in an office all day. I didn't feel like I was doing anything important, so I decided I wanted to do something else. My grandmother had been a registered nurse, and I definitely looked up to her, and I was very close with her, so I kind of looked into that, and I thought that might be a good fit for me because I always really liked science. So I went back to school and I did nursing, and I really like it. I think it's a really good fit for me.
I had some friends that were nurses, had lots of good things to say. I remember my dad being a caretaker for my grandfather when he was ill, so that kind of inspired me as well as to something I could do as a guy. And yeah, I just started back to school in the mid-90s and enjoyed it ever since.
It's kind of a funny story. I was originally going to be a vet from the time that I was like about 6 or 7 years old, and then found out I was allergic to too many animals along my years. So in my junior year of high school, I decided I wanted to stay in the medical field just because I liked the aspect of the science and the medical life, and talked with my aunt, who is also a nurse, and she sort of, I guess, convinced me to go into nursing.
Well, I quickly decided as I was taking my business classes that business was not what I was interested in. The accounting classes got to be a bit too much, and I decided to sign up for some health classes. I started with anatomy and physiology and decided that was exactly where I wanted to be. I really loved that. The more that I encountered the nursing classes and I had the opportunity to care for patients and to spend time at bedside and to be with people in the height of their lifetime, whenever wonderful things are happening for them, and also then spending time with them when it's the lowest point in their life, and to cry with a family and to hold hands and just know that you're there for them, nurturing and caring as best as you can, and helping them to find comfort in those situations. That's what has made me who I am today, those experiences that I've had, and that's very much a part of me.
I think excellence is very easy thing to do. I try to take care of every patient that I see as if they were my own family. Provide them what I would expect for my family, and that easily produces excellence. Specifically, excellence would be making sure that people are up to date, that they receive the medications they need, that they're informed and comfortable.
To me, excellence means meeting your patient's needs, talking with your patient and their family and determining what they want to see happen and helping them to meet their goals and their outcomes and achieve the outcomes that they're looking for, whatever they may be.
Excellence means doing the best job for every person, every time.
And a lot of nurses don't like change, but I actually like try to embrace change because change usually means that we're doing something better for the patient. So I would say sometimes changes can be like irritating, but if you embrace it instead of trying to fight it, it's usually much better.
It's really the only thing that you can be assured is that we will continue to have change. And that is one thing, the ability to adapt to change, because there are changes within a 12-hour shift in nursing. How you care for patients, that care can change from the beginning of shift to the end of the shift, because people are always looking for what's the latest, greatest, best technology. We're so fortunate here. Everyone is committed to excellence here, whether it be the nurses, the staff, the physicians, everybody's looking for the best possible outcomes for our patients. So they're constantly looking to see what is out there and what is available for our patients, and we'll do what we can to make sure that they get the best that's there, the most advanced technology.
Find a good mentor, find someone that you can really ask questions to and feel comfortable asking questions. Find a place where you feel comfortable, and then I think that really helps new grads, because it's a lot at the beginning to learn. And so if you have someone that you feel comfortable to go to, then that can really make all the difference, I think.
Well, working here on Phi South, we're a med-surg now, a tele floor. I always encourage new nurses to start out in the med-surg area. It's where you gain your knowledge base from. And it's a good stepping stone to any place else you want to go, whether it be psych or whether it be the critical care units. No matter what, the foundations that you'll pick up in med-surg are the ones you'll carry with you the rest of your career.
It's frustrating at times, very trying, but don't give up. The change that we make every day may not be seen through the patient's eyes, the visitor's eyes, but you see it every day.
As a new nurse, you're going to feel overwhelmed and like you can't keep up and get caught up, and that's okay. You just need to know that your resources, that you do have resources available, your preceptors, your fellow nurses. Make sure you go to them and seek out advice before you get to the point where you're in an emergency. So seek out others for help. Don't be hesitant. Have the courage to ask for help.
And a lot of the times I tell them, you're not going to get all the information that you need out of a chart, that you need to go to the patient and you need to ask them, because they're the ones living the experience. And a lot of times you can get your information from the patient. Now, I'm saying that I work with babies, so they're not always going to tell me what they need, but you can get a lot of information from the parents or from relatives, because they've been living with their condition and they know best what's going on in their life, so you can get a lot of information from them.
Remember to wash your hands, it's very important.
And don't forget, wash your hands.
Don't forget, always remember to wash your hands.
Don't forget to wash your hands before and after any type of patient care.